Fox 54 verifies all your burning questions about everything. Do you have to turn on your headlights in cloudy weather? Who can prescribe medical cannabis in Alabama? Here's what we checked out this week. The simplified seller's use tax. That's a mouthful, and it only gets more complicated. This tax that's been around for years is suddenly the talk of the town. Local leaders with concerns that it shortchanges city and county governments. But what about you? As it stands right now, does this online tax mean you pay more at checkout? Let's verify. The Simplified Seller's Use Tax, or SSUT, is a state program created in 2015 to collect an 8% tax on online purchases from out-of-state sellers. Half goes to the state, the other half is split among cities and counties based on population, not where the actual purchase happens. But some city leaders, like the mayor of Tuscaloosa, take issue with that arrangement, and now there's a lawsuit challenging the distribution. So how does it all impact the individual buyer? Does the tax we're paying for online purchases make that kind of shopping more expensive than a trip to the store? Let's verify. Our sources are the Alabama Department of Revenue, the Alabama Retail Association, and the Public Affairs Research Council of Alabama. According to Park, Alabama, SSUT is not stacked on top of other taxes for online orders. Instead of paying your local sales tax, you're only paying the 8% tax, and that typically saves you money. The total savings for this depends on where you live. In Madison, the local sales tax is 10.5%, meaning you would save 2.5% on online orders. But Decatur's local sales tax is 9%, meaning you save only 1%. Here's an example of that difference in action. When you order from a local restaurant through DoorDash or Uber Eats, you pay the 8% SSU tax. That same meal purchased in person is subject to local sales taxes, meaning you pay more to dine in. Remember, though, SSUT is only for online businesses based somewhere else. If you purchase online from a small local business, you still pay the higher local sales tax rate. And if you buy from a small out-of-state business making less than $250,000, you may pay no sales tax at all. That's because those businesses are not obligated to participate in SSUT, allowing them to undercut in-state small businesses. So we can verify that the SSU tax actually makes online shopping cheaper for individual consumers, though it may cost your local government millions of dollars over time. If you have something you want us to verify, text us at 256-382-2692. The city of Hartselle was one of the last holdouts in Morgan County, voting just tonight to allow the sale of alcohol on Sundays. But sometimes it works the other way. Have you ever wondered how some cities sell alcohol even if the county they're in is dry? It sounds like a contradiction, but it happens more often than you might think. How is that possible? Let's verify. In Alabama, alcohol laws can be complex. Some counties vote to be completely dry, but you'll find a city inside that county selling alcohol anyway. So how are there wet cities and dry counties? We verify. Our sources are the Alabama Alcoholic Beverage Control Board and the Alabama League of Municipalities. As of today, no state in the U.S. is completely dry, and Alabama doesn't have a uniform approach to alcohol sales either. Instead, it uses a system that gives cities and counties significant control over if and how alcohol is sold. This local control stems from the 21st Amendment to the U.S. Constitution, which ended national prohibition and gave states the power to regulate alcohol within their own borders. According to the Alabama League of Municipalities, Alabama is what's called a local option state. This means voters in each county or city can decide through elections whether alcohol sales are allowed and under what circumstances. Take the city of Hartselle, where city leaders are moving toward expanding alcohol sales to Sundays. The city first legalized alcohol sales in 2016, and this new ordinance would allow residents and businesses to buy and sell alcohol on Sundays for the first time in the city's history. It's a perfect example of how local control works in Alabama, even if Morgan County is dry or partially dry. The city voters decided to allow alcohol sales within their own limits. Now they're deciding whether to take it one step further. Data from the Alabama Alcohol Beverage Control Board says that 44 of Alabama's 67 counties are completely wet, but 23 counties are partially dry or moist. That means they have at least one city that has voted to allow alcohol sales, even if the surrounding county remains dry. In other words, even if a county chooses to stay dry, voters in a city within that county can decide to allow alcohol sales. That's why you sometimes see wet cities in dry counties. So we can verify that local voters have the power to permit alcohol sales in their city, even when the surrounding county does not. If you have something you want us to verify, text us at 256-382-2692. Alabama weather can be unpredictable. One minute it's sunny and bright, the next day it's dark and overcast. Even in the middle of the day, as a driver, you know that poor visibility can turn a simple trip into a dangerous trek. But that raises the question, do you legally have to turn your headlights on when it's cloudy in Alabama? Let's verify. As you commute in the Tennessee Valley this time of year, you may notice some cars with their headlights on in the afternoon and others without them. Some drivers think headlights are needed only at night or when it rains. But what about when it's cloudy? Do you legally have to turn on your headlights when it's cloudy in Alabama? Let's verify. Our sources is the Alabama Code. Here's what we found. In Alabama, headlight laws aren't as simple as daytime off, nighttime on. Vehicle headlight laws are set by state statutes. According to Alabama Code 325240, headlights must be turned on in the following cases: from a half hour after sunset to a half hour before sunrise, anytime the windshield wipers are in use because of rain, sleet, or snow, and anytime there is not sufficient light to clearly see persons or vehicles on the highway at a distance of 500 feet. This law applies to all vehicles on Alabama highways. Parked cars are exempt. In other words, whether it's nighttime, raining, snowing, or visibility is poor, Alabama law requires headlights to be on. But the law doesn't say cloudy weather automatically means headlights on. Instead, it focuses on visibility, which can be subjective. If conditions make it hard to see vehicles or pedestrians clearly at 500 feet, headlights must be turned on. This includes heavy cloud cover, fog, or any other situation that reduces light sufficiently to impact safety. Code 325240 also specifies that headlights are required when windshield wipers are active due to rain, sleet, or snow, except when the use is intermittent for light mist or sprinkles. This ensures that vehicles are visible even during bad weather. So we can verify that no, you don't have to legally turn your headlights on just because it's cloudy. But if it's so cloudy that visibility is low, your headlights should be on. If you have something you want us to verify, text us at 256-382-2692. Alabama is one step closer to having access to medical cannabis. The first ever licenses were granted by the Alabama Medical Cannabis Commission. But it's not as simple as just asking your doctor. So how does someone legally get a medical cannabis recommendation in Alabama, and can any doctor issue it? We verify. Alabama's medical cannabis program has been slow to launch, with obstacle after obstacle delaying the process. The medical cannabis program was approved in 2021, but was delayed because of licensing disputes and years of legal challenges that stalled its implementation. The Commission's initial license awards were stopped back in 2023 after such disputes, legal challenges, and allegations of Open Meetings Act violations. Today's approval means the 3 approved companies must now pay licensing fees, which are due by the end of the year, to move forward, with those licenses expected to take effect January 8th. But will any doctor be able to legally recommend medical cannabis? Who qualifies for a recommendation, and what types of products are legal for patients to use? Let's verify. Our sources are the Alabama Board of Medical Examiners and the Alabama Medical Cannabis Commission. According to the Alabama Board of Medical Examiners, physicians who want to recommend medical cannabis have to go through a formal state process. They need to be licensed in Alabama, have controlled substance and DEA registrations, complete a board-approved course, pass an exam, and have practical medical experience. They must also register with the state's medical cannabis patient registry. Once certified, doctors cannot use telemedicine to recommend cannabis, refer patients to specific dispensaries, accept payment from anyone but the patient, or recommend it to pregnant patients or those with certain conditions. This program is designed to ensure that recommendations are made safely and legally, so we can verify that no, not just any doctor can legally recommend medical cannabis, but that raises the next question: who actually qualifies to receive a recommendation? According to the Alabama Board of Medical Examiners, patients must have at least one approved medical condition to qualify. This includes autism spectrum disorder, cancer-related symptoms like nausea or weight loss, chronic or intractable pain, Crohn's disease, depression, epilepsy or conditions causing seizures, HIV/AIDS-related symptoms, panic disorder, Parkinson's disease, persistent nausea not responding to traditional treatment, PTSD, sickle cell anemia, spasticity associated with motor neuron diseases or multiple sclerosis, terminal illness, Tourette syndrome, and conditions causing chronic pain where conventional therapy is ineffective. But having a qualifying condition alone isn't enough. Patients must see a certified physician in person to receive a medical cannabis recommendation. The physician must personally examine the patient, keep detailed records of the visit, and submit the recommendation to the state patient registry. Once patients have a legal recommendation, they can only access products approved by the state. Tablets, capsules, tinctures, gel, oils, creams, suppositories, patches, or inhaler liquids. Products like smokable cannabis, vapes, and edibles are still illegal, according to the Alabama Medical Cannabis Commission. And if you have something you want us to verify, text us at 256-382-2692. It's that time of year when everyone's trying to avoid getting sick, and you've probably heard the warning, don't go outside with wet hair, you'll catch a cold. But is that really true or just something we all grew up hearing? Could going out in the cold with wet hair actually make you sick? We verify. Ever rush out of the shower in the morning and wonder if stepping out with wet hair could make you sick? We've all heard the warnings, but is there any truth to it? We verify. Our sources are the Mayo Clinic and the Cleveland Clinic. According to the Mayo Clinic, the only way to catch a cold is by coming into direct contact with the virus. That usually happens by breathing in virus-containing particles from someone who coughs, sneezes, or blows their nose. You can also pick it up by touching a contaminated surface. For example, if someone with a cold grabs a doorknob and then you touch it and later touch your eyes, nose, or mouth, the virus has found a way in. The Cleveland Clinic points out that colder months can increase the spread of colds, not because of wet hair, but because people spend more time indoors with the heat on. Running the heat dries out the air and dries out your nasal passages. When your nose produces less mucus, your immune system has to work harder to fend off viruses. The Cleveland Clinic also notes that colder air can help certain viruses like the rhinovirus, the most common cause of colds, travel more easily through the air, making infections more likely in winter. Experts also say airborne infections tend to pass more often and more easily between people when in a smaller space. And while wet hair itself doesn't cause illness, it can make you feel cold and uncomfortable, which is probably why the warning exists. But feeling chilly doesn't mean you're infected. So we can verify no, going outside in the wintertime with wet hair will not give you a cold. The only way to get one is by coming into contact with the virus itself. If you have something you want us to verify, text us at 256-382-2692.